Hello, friends. Imagine checking your Social Security bank deposit and seeing an extra $202.90 sitting there every single month. For millions of seniors, this isn't a pipe dream. It is money being quietly deducted for Medicare Part B that a heavily under-publicized state program is actually supposed to pay for you. The government will not automatically enroll you, and no one tells you about the exemptions that protect your savings, but today I am giving you the exact steps to claim your $2,434 back this year. I want to be perfectly clear right up front. This isn't a random stimulus check or a special IRS refund. This is a existing state-run benefit called the Medicare Savings Program that officially stops your Medicare Part B premium deduction so you keep your full Social Security check. By the end of our time here, you will know exactly which tier of this program you qualify for, the exact asset exemptions that protect your home, and the step-by-step process to get your state to pay your Part B premium in 2026. Stay until the end because I am going to show you the automatic prescription drug loophole that triggers the moment your premium application is approved. Take a second and subscribe to the channel. The rules around Medicare and Social Security change every single year, and the government simply does not explain your options. The people who subscribe to this channel find out in time to act. The others find out after the money is already gone. To understand how to get this money back, you first have to look at the exact math of what the government is taking from you this year. If you are a retiree, a surviving spouse, or a disabled person currently enrolled in Medicare Part B, you already know the sting of that monthly premium. For 2026, the standard Medicare Part B premium is exactly $202.90 per month. That money never even hits your checking account. The Social Security Administration strips it out of your gross benefit before they send the rest to your bank. You need to verify this number for your own records. Log into your personal portal at ssa.gov/myaccount. Download your 2026 benefit verification letter. Look straight down the page and locate the Medicare Part B deduction line. You need to see with your own eyes that you are actively paying that $202.90 out of your gross benefit. Let me show you what this actually looks like. I was speaking with a gentleman named John recently. He is 68, living in Ohio. John's gross Social Security benefit on paper is $1,700, but because of that Part B deduction, his actual net deposit, the money he buys groceries with, is only $1,497.10. When you run that math out, $202.90 deducted every month for 12 months equals $2,434.80 lost per year. Over 5 years, John surrenders $12,174 from his fixed income just for basic outpatient coverage. Now, if you are a high-income senior paying the IRMA surcharge, meaning your modified adjusted gross income as a single filer is over $109,000, you are seeing even higher deductions. Those IRMA penalties range from $284.10 all the way up to $689.90 a month. But those high-income households do not qualify for the financial relief programs we are covering next. This program is for the millions of seniors living on fixed incomes who need that $200 back. And the entry level for that relief is a program called the QI tier. QI stands for Qualifying Individual. To qualify, you need to be a single senior with a monthly income up to $1,816, or a married couple with an income up to $2,455. Depending on where you live, especially in Alaska or Hawaii, those state limits might vary slightly, but those are the federal baselines. The QI program pays your monthly Part B premium, full stop. But there is a massive catch that trips up thousands of applicants every year. This specific tier operates on a strict first-come, first-served basis. The federal government only gives the states a capped amount of funding for the QI tier. Once the money runs out for the year, the window closes. You cannot fix this through Social Security. SSA does not process this. You have to call your state Medicaid office. When you get a representative on the line, you ask specifically for the Medicare Savings Program QI application. You need to submit that form as early in the year as humanly possible, along with your SSA, 1099 form as proof of income. Once submitted, you wait roughly 30 to 45 days for the state to notify the federal government to physically stop the deduction. Take Mary, a 71-year-old widow in Texas. Her total monthly income is $1,750. That puts her right in the sweet spot for the QI tier. Her gross is $1,750, but her bank was only seeing $1,547.10. She applied in January. Upon approval, that $202.90 deduction stopped. Over 1 year, she regained her full $2,434.80. Over 10 years, that is $24,348 kept in her own bank account. Because of that capped funding rule, a senior applying in November might be waitlisted until the new calendar year, whereas Mary applying in January gets immediate approval. If your income is slightly lower than that, the benefits become guaranteed rather than first come, first served. We step down to the SLMB tier. That stands for Specified Low-Income Medicare Beneficiary. The income thresholds here are $1,616 for a single senior and $2,184 for a married couple. Unlike the previous tier, the SLMB program is an absolute entitlement. If you meet the numbers, they have to pay your Part B premium. It is not a capped fund. The money is guaranteed. To get this, go to your state's Department of Health and Human Services website, print out the physical Medicare Savings Program application, gather your last 3 months of bank statements to prove your exact income, then mail that physical packet to the state office and do it with return receipt tracking so you have a signature proving they received it. Consider Robert and Susan down in Florida. They are a married couple with a combined Social Security income of $2,100 a month. Both of them are on Medicare Part B. That means both of them are losing the $202.90 premium out of their checks. 2 premiums times $202.90 means $405.80 is vanishing from their household every single month. By securing SLMB status, they regain that entire $405.80 a month. Their annual gain is $4,869.60. Over 5 years, Robert and Susan keep almost $25,000 of their own money. Even if you are a married couple where only one spouse is over 65 and on Medicare, you still use the couple's income limit of $2,184. The savings will only apply to the one premium of $202.90 a month, but the higher income threshold makes it much easier to qualify. But what if your income is very tight? If you fall below the $1,350 mark, you unlock the absolute highest tier of financial protection in the American healthcare system. This is the QMB tier, the Qualified Medicare Beneficiary Program. The limits here are tight. Single seniors under $1,350 a month and couples under $1,824 a month. QMB is the gold standard. It pays the Part B premium, but it goes much further. It also covers your Medicare Part A and Part B deductibles and your copays. Critically, federal law makes it highly illegal for doctors to balance bill a QMB patient for the remaining 20% that Medicare does not cover. You apply for this exactly the same way through the state Medicaid office. When approved, you receive a specific state QMB identification card in the mail. When you go to the doctor, you present both your federal Medicare card and your state QMB card at the front desk. If the billing department tries to charge you a copay, you look them in the eye, inform them you are a QMB patient, and remind them that balance billing is prohibited by federal law. Betty is 72, living in Michigan with a strict monthly income of $1,200. She goes to a specialist for a chronic condition. Normally, that doctor charges a $50 copay per visit, and she is required to meet the Part B annual deductible out of her own pocket. Because Betty is on the QMB tier, the math changes completely. She saves the $2,434.80 a year in premiums. Plus, she saves the entire 2026 Part B deductible of $283. Plus, those $50 copays over 5 specialist visits wipe out another $250 of expense. Her total 1-year financial relief is $2,967.80. To put that in perspective, a senior on the regular SLMB tier still has to pay that $283 deductible and their 20% copays. A senior on QMB pays absolutely $0 for covered medical services. Now, millions of seniors hear these income limits and think they don't qualify because they have some money in the bank. This is the biggest myth of the entire program. We have to talk about the hidden asset test rules. People assume that if they own a home or a car, they are disqualified from state assistance. That is factually wrong. The federal asset limit to qualify for these programs is $9,950 for singles and $14,910 for couples. However, your primary home, one car, your household goods, and a $1,500 burial fund are completely exempt from this math. They do not count against you. I want you to get a piece of paper and create a 2-column list. Put your checking account, savings account, stocks, and bonds in the first column. Title that column Countable. Put your house value, your car, and your furniture in the second column. Title that column Exempt. When you fill out your state application, you only submit the total value of the countable column. David in Georgia is a perfect example. He owns a house worth $300,000. He drives a $15,000 car. He has $6,000 sitting in a checking account. If you look at his net worth, David is worth $321,000, but the state only looks at his countable assets. His countable assets are exactly $6,000, since $6,000 is well below the $9,950 federal single limit. He qualifies fully. David gets his $2,434 a year premium covered despite owning a $300 home. State laws drastically alter this math in your favor. California completely removed their asset test a few years ago, but they reinstated a massive new asset test effective January 1st, 2026. The new California limit is $130,000 for a single person and $195,000 for a couple. Places like New York and Alabama have no asset test at all. Your savings could be massive, and you would still qualify based on income alone. Once you realize the math is actually on your side, you have to navigate a maze of government bureaucracy without making a fatal mistake. If you are struggling to figure out your specific state's Medicaid portal, you do not have to do this alone. There is a state application bypass that completely removes the headache of government paperwork. It is called the State Health Insurance Assistance Program, or SH. This is a federally funded, completely free counseling service that will fill out the Medicare Savings Program paperwork for you. Do not pay a private advisor to do this. Go to shiphelp.org or call the National Medicare line at 1-800-ED-MEDIS Medicare. Ask the operator for the direct phone number to your local county's SHEOP office. Call them and make a phone or in-person appointment. You sit down, hand them your documents, and have the certified counselor submit the exact state-specific forms on your behalf, ensuring there are 0 errors to hold up your money. Tom lives in Nevada. He tried to apply by calling Social Security. The SSA told him they couldn't help him because it's a state program. Private Medicare advisors in his area charge $300 to $500 for consultation fees just to file the paperwork. Instead, Tom called his local SHIP office. A counselor spent 45 minutes filing the state portal application for him, entirely for free. Tom saved a $500 consulting fee, and he secured his $2,434 a year in premium relief. If you live in a rural area, you can have your SHIP counseling done entirely over the phone from your kitchen table. If you live in a city, you can usually walk right into a local senior center for hands-on, face-to-face paperwork help. And when that paperwork goes through and you finally get approved, there is a massive hidden bonus that triggers automatically behind the scenes. This is the automatic prescription drug loophole I promised you earlier. If you are approved for any tier of the Medicare Savings Program, whether that is QMB, SLMB, or QI, you are legally deemed eligible for the Federal Extra Help Program for Part D prescription drugs, also known as the Low Income Subsidy, or LIS. You do not have to apply for this separately. The trigger is entirely automatic. Once you receive your MSP approval letter from the state, you wait roughly 2 to 3 weeks for the state computer systems to sync up with the federal Medicare systems. Then you simply go to the pharmacy to pick up your medications. The pharmacy system will automatically code you for the LIS subsidy, which drastically caps your generic and brand name copays by federal law. Sarah is a senior in Pennsylvania. She got approved for the SLMB tier. She takes a brand name medication that used to cost her $150 a month out of pocket. Because she secured the Medicare Savings Program, the extra help triggered, her $150 drug drops to the statutory LIS cap, which is right around $11.20. She saves $138 a month on her drugs. That is $1,656 a year. Add that to the $2,434 Part B premium savings, and Sarah's total fixed income increase is $4,090 per year. Over 10 years, that is over $40,000 injected directly into her life, simply because she filed the right state form. The tragic part is that a senior who applies for extra help directly through Social Security might actually get denied due to minor federal income limits. But if they bypass the SSA apply for the Medicare Savings Program through their state and get approved, the extra help is granted automatically regardless of the federal limits. To wrap this up cleanly, the government is taking $202.90 out of your check every month. If your income falls under $1,816 single or $2,455 married, the QI tier will pay that premium if you apply before funding runs out. Lower incomes hit the guaranteed SLMB tier, and the lowest incomes hit the QMB tier, which completely bans doctors from balance billing you. Your house and one car do not count against you, and California just raised their asset limits to $130,000. Free ship counselors will do the paperwork for you, and the moment you are approved, your prescription drug costs plummet automatically. You earned every penny of your Social Security over a lifetime of hard work. Do not let $2,400 a year slip away simply because the government didn't tell you the paperwork existed. Subscribe. Share this with someone you know who's on Social Security or Medicare. I'll see you in the next one.